Hi Lexington, my name is Kevin Hall. I'm the Communications Officer for the Lexington-Fayette County Health Department. We're getting ready to talk about the COVID-19 vaccination rollout in terms of what the health department is doing and be able to answer some of your questions. Now first, I'm going to take this mask off. I'm going to take this off because I'm in a room with one other person who is well more than 6 feet away, and I want to make sure that you're able to hear me clearly, see my lips for people who need to be able to see that for the communication piece. But we are following the guidelines with the distance. The other person has their mask on, so we just wanted to reinforce that. Today we get it. We're not going to be able to answer all of your questions because there are so many questions, but we wanted to hit the main ones that we're seeing about the vaccine rollout here in Lexington and what the health department's role in that is. We can't speak for every place that's giving that vaccine, but we're hoping that by hearing me talk directly as a representative of this department, we can make you feel at least a little better about what's happening or have an understanding of what we're doing. So there's so many people who don't fully understand what our role is, what we're doing, what's happening, what's next, and want to just take a little bit of time to do that. Christina King is on the other side of the camera, who is fielding what's coming in through Facebook and also has a list of some of our frequently asked questions that we're getting. And we'll jump into those in just a minute. I want to give it a little bit of time, though, for people to get logged in here, to tag your friends, and to share this with people because we know you're hungry for this. When we posted this at 1:15, people are sharing this immediately. I've done a lot of interviews today, so forgive me while I take a few sips here and there to stay hydrated. Again, I'm Kevin Hall. I'm the Communications Officer. I've been doing a lot of interviews about this, and this is our first Facebook Live to talk directly to you. First thing I want to tell you, though, before we start getting these questions that are coming in and the questions we've seen, is just to remind you, if you can, please be kind, please be patient. I can't stress enough that the people who are out there giving the shots, who gave the shots today, the people who are working on this response are working so hard on this. I've never seen the hours and the effort put into this. It's also difficult to tell people to wait for the next phase of the vaccine. I want to just speak directly to you on that because I am the person who's most often answering your questions on social media. Christina does as well. And we have a call center who gets calls throughout the day. On a typical busy day in October, for instance, a busy day was 250 calls. On Monday, we had 1,000 calls. So you can see the interest is there, which is great. But we need you to ask you to be patient and to be kind and try to be understanding about our role in this. And where I was going with that is that the people that I most often interact with on our social media, I'm getting questions from people who are in their 70s, people who often have underlying health conditions. And these people, these are like my parents. It reminds me of my mom and dad. It reminds me of my grandmother. They are interested in the vaccine. These are people who want the vaccine, and we want to help you. But the issue right now, and we empathize with the fact that you're not getting the vaccine that you're desperately wanting. You've been following these guidelines for months now. The people who want this vaccine the most are the people who have been physically distant, the people who are wearing their masks, the people who aren't going places. And we want you to have it. We understand it. It is hard to say wait. But it is not a matter of demand. It's a matter of supply. And at the health department, we are not getting mass quantities of the vaccine every week. What we are getting, we're using almost immediately with no doses going to waste. There are no doses at all from the Lexington-Fayette County Health Department going to waste on this. So understand that if we tell you to wait, that it honestly, we've talked about this internally, and is that it's heartbreaking because we know you want this so badly and we want you to have it. So let me just tell you a little bit about the rollout and where we are. Again, I'm Kevin Hall, the Lexington-Fayette County Health Department. The vaccine distribution began in terms of the health department on December 23rd, so 2 days before Christmas. We received 200, 300 doses of the vaccine and to provide to healthcare workers. Phase 1A, as identified at that time by the CDC, the federal government, and our State Department for Public Health, identified healthcare workers as the primary target. Why is that, people ask? It's because our goal is not to give shots to all 330,000 people in Lexington. It is to vaccinate the vaccinators. If we can keep our healthcare workers healthy, then they can continue taking care of you for COVID-19, the flu, a broken arm, heart surgery, whatever it is that you have and that you need. And then also they can give the shots. They're capable of giving shots on a regular basis, and by getting those nurses, doctors, pharmacies, all of those people who can give shots, getting them protected allows them to give you the shot in the future. Phase 1A, so healthcare workers in Lexington, this boggles the mind sometimes. We have more than 20,000 healthcare workers just here in Lexington. So it takes a while to move through that, because it's not just first dose, there's a second dose. It's 2 pieces to that. Also, the reason we want them to be protected is because the next group, phase 1B, just looking at 70 and older, do you have any idea how many people in Lexington that comes out to? It's around 30,000. About 10% of the population will be in 1B. That's not counting the K through 12 faculty and staff. That's not counting the first responders or anybody in that category. So 30,000 plus people who are 70 or older. That's why we need those healthcare workers in this assistance. So back to December 23rd. It was a Wednesday. We received the shipment of the vaccine early that week. By the end of that Wednesday, 2 days before Christmas, we had it in the arms of all the healthcare workers without any doses going to waste. We started small, in part because that's all we got. We didn't ask for a lot. We didn't get a lot because there were staffing issues. There weren't people available. There were people who we also didn't know what it would be like to bring people in. Were people going to be available because it was so close to the Christmas holiday? It was also a chance to learn and to grow. And grow we have. We went from 300 to around 900 to around 1,500 last week, and we just finished roughly 1,800 to 2,000 shots. I don't know what the final count was, but it was very active, very busy. No shots were gone to waste. We were able to register people in advance, those healthcare workers. They can go to our website, lfchd.org. There's a link on there to help you get notified. You can sign up to be notified on future clinics for healthcare workers. Because we allow you to register, we know how many people to expect, and we plan accordingly, and we give the doses to those people. That's where we are, and now Christina's going to ask me some of the most common questions we're getting. I'm sure there are questions coming in. Christina, are people sending them as we're watching? So we're going to try to hit the ones we're getting the most. And again, look through some of our previous Facebook posts. You're going to see a lot of information on there. And to know also, we can't speak on behalf of any other agency. Well, I forgot this part. It's an important piece. We're not the only place in town giving the vaccine. Hospitals are taking care of their staff members. Large practices are taking care of their workers. We're trying to help those healthcare workers who aren't affiliated with a hospital, who aren't part of a large clinic, to get vaccinated. So it's the medium to small size places that need that shot. So that's who we are working on. It's who we're working with. So Christina, we've got a list of some questions. If you want to go ahead and start asking those, I'll answer the best I can.
Absolutely, Kevin. You have already gone over these answers, but I want to clarify for our watchers. One of the main questions we're being asked is, why are you still in phase 1A?
That's a great question. It's why are we in phase 1A? So we have 20,000 plus healthcare workers in Lexington. We've got to take care of them. Now, a common thing that we hear from our call center is, well, the CDC changed to this. The CDC has said, Dr. Redfield has said, and Dr. Stack, our state commissioner, that those are guidelines. They're not regulations. They don't have to be followed on that. And it's to help people plan. Because in Kentucky, Fayette County is different from Scott County, from Powell County, from Clark County, from Montgomery County. We're all different. We have different makeups. We have different amount of staff, different amount of healthcare workers. So it's to give you a guideline on it so that no vaccine goes to waste. So if you're in a place that has taken care of everybody in 1A, they don't want you just sitting and waiting. They want you going ahead and giving that to those other categories and to the people who need it. We're not seeing that in Lexington. When we find out, when we put the link out to register healthcare workers, when it opens, let's say it opens at 10 a.m., by noon or 1, probably 1,300, 1,500 people have signed up. There's so much demand there. There's not the ability to go to other categories, and it's because we're not getting an overwhelming amount. Again, the most we've had so far is for for this week, about 1,800 to 2,000 doses. The good news is the governor has said they're going to start allocating more to these larger populated areas. So that should be coming soon, and hopefully that will help. So that's why we're still in 1A here in Lexington in terms of the health department.
And this next question is a very frequent question we get, and it kind of goes along with your answer to the last question, but why isn't this going faster?
We understand that. It's easy for people to sit on the outside and say, why isn't this going faster? But you ask anybody who's come through our clinic, it couldn't go any faster for the people who are here. So one, our clinics themselves are going they're very swift, they're very efficient. People are getting in and out in a matter of minutes. But the rollout itself, it's limited to the doses we receive. Kentucky only receives a certain amount from the federal government. The federal government's the one who decides how much each state gets. And then that gets sent out from the state to all the different counties in Kentucky. And remember, there are 120 counties in Kentucky. It's not just Fayette County. As much as we love and think Fayette County is number one, there are still 119 other counties that have to be taken care of here in Kentucky. So on one hand, we can recognize that it's slower than what you might anticipate. But keep in mind, think back to earlier this year. Testing also started kind of slow. It was hard to get opportunities for testing, but the more people who got brought on board, the more labs that got trained, the wider and more available it was for the general public. It's the same thing with the vaccine. This isn't something that just a nurse can pick up a syringe and start giving a shot. There is a very involved test and training session that they have to take, an online course that they have to take. It's about 2.5 to 3 hours, and the nurses I've talked to said this isn't the sort of thing you skip ahead, take the test, and you pass. You have to pay attention to this. It's tough, and they're doing their best they can in that. So on one hand, we understand it's slower than what you would like, but people are moving through it as quickly as they can. Fortunately, the hospitals, who have many more staff than what the health department has, have been able to give at a pretty high clip the vaccine to their staff. That frees them up to provide it to more healthcare workers. This is what we're seeing here in Lexington. The hospitals have taken care of their staff, and they start filling in the gaps elsewhere. Can't say enough good things about those people who are helping with that.
Okay. And another question, why are we not letting other people have the extra doses?
And it's a hard one to explain because there are no such things in Lexington as an extra dose. There are no extra doses. I went over that on Facebook the other day, and I had to laugh because somebody said, well, what are you doing with extra doses? There are no extra doses. Yes, but what are you doing with them? They don't exist. We use the vaccine we have. We draw up, if we know 10 people are coming in, we draw up, we use that the 10 doses in that vial. If at the end of a clinic, like today, at the most we've ever had, we have like 2 or 3 doses usually at the end of it that have been drawn up, and we make sure they go to people who need them, whether it is members of our staff or if it's the volunteers who are working here. And we're doing these at a church here in Lexington, Consolidated Baptist, seeing if they've got people who fall into the categories who need those. They're not wasted. Now, another question that's not one Christina just asked, but it falls into that. Well, what about County X who's doing a waiting list? That's great. That's great for that county, but it's more likely it's a smaller county, and that they don't have 300,000 people who would be on the list waiting to be told. It's a little complicated. Let me see if I understand it, because it was explained to me this way. Once you open the vial, once it's ready, you have a limited amount of time that it can be given, the shot can be given. So at the end of our clinic, if we've got 4 doses left, if we don't have the ability to go down a wait list for 200, 300 people to find out who could be here in a matter of 5 minutes, because we have to close up, we have to get out of here on behalf of the church. You can't be here all night. But I can assure you, and it's up to you to choose whether you believe me or not, and I hope you do, because it's the truth, and there's nothing more that I can say. The vaccine's not going to waste. It is not going to waste, and it is being used effectively and efficiently to the people who need it in 1A.
Okay. And why can other phases not sign up for notifications?
It's a great question. We understand it. There's really a couple of reasons for that. First of all, the honest answer for the health department is we aren't sure what phase 1B will look like with our involvement. Our plan from all along was to take care of healthcare workers, to get them involved in phases 1B, 1C, and beyond. So we don't want people coming to the health department signing up on a notification form like healthcare workers, and then we aren't the ones contacting them, because that would cause some confusion, mass confusion perhaps. The good news is the city, the mayor, Mayor Gordon, who is a nurse first and foremost, in addition to becoming mayor, she's created the vaccine task force. So all these different groups are coming together. There should be information coming very soon. I know one of the things they're working on is that registration piece. They want to get this out to the public. And the reason that will be so great coming from this group is that if you call in or you get notified that there's a vaccine, you need to find out, you want to get the shot, but the one on at X road is unavailable, they can point you to the one over on B lane. It's going to be a lot more efficient. It's going to be the communication is going to be better, so that everybody knows, the partners who are working on this know what's going on, and there's just more staffing and ability to take care of it for the community. So we understand where you're coming from on it. We're just not equipped to be able to do that yet, because we just don't want you signing up for something and it go to another place.
And why are other counties already in phase 1B?
They have fewer people. They have, if you think about it, I use Powell County a lot as an example because I grew up there. Powell County has maybe 10,000, 11,000 people. So that's half the amount of healthcare workers that we have here in Lexington. So it's just by itself going to take longer to take care of our healthcare workers. It's great that those other places can move on, but it works both ways. I get told from the director of these other places or friends at these other places, they get asked, well, why aren't you doing what Lexington's doing? There's a plus and a minus to being as large as Lexington is. On one hand, we do have more resources to do things, but on the other hand, we have more people, so it takes longer. We also, I think of a question that came in. It was, well, why don't you quit doing testing or pull back from testing and do more of the vaccine? We're not doing the testing. The testing is through private labs that are being run, and we don't have a hand in that. So we're putting our resources into this to try to help take care of people. At the same time, while still operating our health department, because we still have to inspect restaurants, and we still have to make sure we have our WIC program for mothers and infants and children. We have to make sure that we have our STD program, our testing program, our harm reduction program, to make sure Lexington doesn't have, giving flu shots still, to make sure there isn't an outbreak of that. We're still doing all of that in addition to this limited amount of vaccine that we're able to give.
We have a Facebook viewer right now who is curious how those who get the first vaccine can be assured that the second one that will complete the process will be available.
Okay, great question. So the question is, if you've gotten the first vaccine, and I'm assuming this is through the health department, I'm going to just, for the sake of clarity, say it's through the health department. And the reason I'm going to do that is because if you got it somewhere else, you need to contact that place on how to get the second dose. If you received your first dose through us, we will contact you on how to get your second dose. You had to sign up through our registration form. We have your phone number, or shoot you a text to let you know, here's how you sign up for that second dose. And that's going to be coming soon. The people who got their shot on December 23rd will be able to get their shot next week. So we'll have that announcement out very soon to those people. The advice that has been given out to departments is not to hold back vaccine on second doses, so people getting their second dose will be worked in with the first dose. Now, all of that could change tomorrow. That's another wrinkle in all of this. Everything that we talk about today, it's an evolving situation. It's very fluid. It could change tomorrow. Guidelines could change tomorrow. Regulations could change tomorrow. The plan is for right now, though, you'll get that vaccine. You'll get notified by us. Now, if anything changes, we'll let you know. We'll post it on our Facebook, social media, on our Twitter, probably not our Instagram, maybe. It'll be on our website, lfchd.org. We'll do interviews. We'll get the word out. And again, if you signed up through us and got your shot through us, we're going to notify you.
Another question we have on Facebook, is there a process to get more vaccine from the feds?
That's at the state level. The state makes the request to the federal government. The federal government gives it to the state. And there are a lot of issues that are happening at the state, and they are doing everything they can to protect everybody in all 120 counties, and not just the two large ones of Jefferson and Fayette County. It's making sure that the smallest county gets treated with as fairly and equitable as everyone else, because they're just as important as you watching here in Fayette County. If you've there's always, we like to say, if you've got questions, you'll direct it to your, that's what our representatives for. It's what our elected officials are for, is talk to your elected officials. We work very closely with the city council here in Lexington to try to keep them updated on information, and I know they're a great resource. Now, they are not the ones, obviously, at the state level, so talk to your state representatives, but let them know, like, this is what my concerns are, what we need, so they can make sure that gets passed along. But it's the federal government to the state government to all the different counties and health districts in Kentucky.
Ms. Ridgway just asked us, with people of color suffering from COVID-19 deaths at a rapid rate, what are your goals and ways that you will reach out to those populations to assure that health equity is considered?
Well, first, let me put a plug in for an interview that we're doing. So if you didn't hear, the question is, what are we doing for people of color, particularly with African Americans who have been disproportionately affected by COVID-19 with the cases and deaths as compared to other races and ethnicities. I believe I captured that. Is that right, Christina?
Yes.
First, Casey Allen Bryant is a public health professional, a nurse here in Lexington, and a member of our Board of Health. She's going to be doing a radio interview tomorrow, 6 p.m. on Thursday. It's live on Radio Lex. So if you're in Lexington, you can listen live on 93.9 FM or stream it at radiolex.us. So that's US, radiolex.us. And Casey talks very openly about the historical issues that minority populations have faced to build the distrust about vaccines, and she is very well versed in this and doesn't shy away from some of these really ugly historical topics. So that's one thing I wanted to go ahead and put out there. We're going to talk about it in every interview possibility we can. We're going to talk about it like this. I'm going to go back to that task force. The communication education piece is going to be launching a campaign coming out soon, hopefully end of the month, maybe into February, to target people that have questions about the vaccine. And that very audience that Ms. Ridgway mentioned, that's one of the goals in that, is to try to talk directly to you about those really tragic things that happened in the past, and to build that trust up in us now. So hopefully that answers your question. And if you want to be a part of sharing that message, please reach out to us, because we would love to have as many people who believe in this vaccine. If you believe in it, we want you to help share the word to others. That's another part. Let me just back up. We've been at this a long time, and when people talk about COVID-19, I can promise you, you are not as tired of it as our public health workers or our doctors or our nurses. We've been going at this nonstop for almost over 10 months, since March of last year. We've had a lot of people who've been very hateful to us, the anti-vaxxers, the people who don't believe in the mask, the people who think we're taking away their rights, and what have you. And that's an easier group for us to handle some of the negativity from than it is the people who support what we're doing, or the people who believe in what we're doing, or the people who believe that this is real and is as bad as it actually is, and so have been doing all the things the right way, which is why, if you have a question, ask us. We try to answer the questions on our social media, or the 1,000 calls that we get in the call center. So don't sit and think and just attack. Ask. We want to educate you. We want to inform you, because the people who are asking these questions now are the people who want the vaccine the most, and we want you to have that information, because we want you to feel good about this whole process, so when you do get it, you tell your friends, neighbors, family, hey, I got it, it's important.
Grace Bates would like to know what the current estimation on what level of vaccination we need in order to see a significant reduction in transmission or herd immunity.
Okay, great question, but not one that I'm able to answer, because I'm not going to be able to talk about the science or the medical piece of that. That's not my specialty. I wanted to talk today about the actual rollout and what we're doing with the phases in Lexington. So great question, Grace, but not something that I'm able to answer right now. But you can probably direct that, if you want to direct that to that call center or to the COVID email address, covid19@lfchd.org, to get that answered. I want to just let everybody again know we're going, I'll answer the questions as long as we're on here. We're going on 30 minutes now. I'm Kevin Hall. I'm with the Health Department. I'm the Communications Officer. You can get a lot of questions answered through our Facebook or on our website, lfchd.org, about the phases, about why we're doing it the way we're doing it. We've got a link to the Kentucky plan. The Kentucky plan is Kentucky's been great about this. The State Department for Public Health, their entire plan is on the website, and every day the governor and Dr. Stack talk directly to you with that information. So go to those sites to learn more and tell people about how they can use that opportunity or use those tools to learn more.
Laura Gulami is a little confused, and she says she's reached out a lot, but she can't get a straight answer. She would like to know what group transplant recipients might be in.
Honestly, I don't know the answer to that. I'm not trying to give you the runaround. I'm sorry that you don't have the answer to that. We follow what the CDC lists as a healthcare worker, and right now, if you're not a healthcare worker, we can't give you that shot. If you are, I would just, as soon as we get information about other places or other phases, we'll have it on our website, on our social media. You can call, or I would advise you to just check the state website. It's ky.covid19.ky.gov is that site. It links on our site, lfchd.org. You've got the plan, you have the definitions on there.
Okay, we've got some more questions coming through. They're loading. Bear with me just a second. I apologize,
Are there
viewers.
any more from the frequently asked questions from our first list?
Yeah, we've gotten a couple of repeats again asking that have joined late, asking again for clarification on why people not in Phase 1A can't go ahead and sign up for notifications.
Yeah, we'll hit this again, and it's a great question. We understand. I'll try to shorten the answer this time.
They're asking if we can start some sort of standby list.
We don't have the ability to do the standby list because there is nothing to stand by for. There are no vaccines there are no extra vaccines available with some of the other counties, the smaller counties that we're hearing the reports of. When we have the vaccine clinics, it gets used. There's nothing really more that I can say to explain that. In terms of other phases signing up, there's going to be pieces to that coming up very soon. I know you don't like hearing wait. Nobody likes hearing wait. We don't like telling you wait, but there are more pieces at play to bring everybody together, because it's not just the health department initiative. So many people of Lexington are coming together to make this happen, to help protect people.
And that seems to be all of the new questions. I would like to say we are getting lots of thank yous from our viewers right now. We've got over 119 viewers, and quite a few of them are telling us thank you. And I would like to say you are very most welcome.
Yeah, if you didn't hear that, we thank you for being on this. We hope we answered your questions. One of the things we're going to try to do, we'll go through and the questions that are on there. We'll try to put some of the written responses in there for people so that they don't have to watch this whole 30 minutes. It's great viewing, I think, but we'll try to put it in the comments. Hopefully our goal from this is, if you've learned something from this today, share it with your friends, share it with your family, share it with anybody who needs to learn about this, because we want to be out in front of this. We want to talk directly to you, and this is a great way to reach as many people as possible. So I'm going to go ahead and wrap it up. It's been 30 minutes. If you have questions, we do try to answer them as much as we can on Facebook. We're not on there 24/7, so be patient on there. Try to look through some of the comments to see some of the things we've already answered on some of the previous posts. And go to if you're a healthcare worker, go to our site to get signed up for notification on future clinics. Doesn't mean that you're guaranteed a shot. And be mindful that it overwhelms our system. It crashed this last time because too many people were signing up as soon as it came open. That's all I have. Thank you, Lexington. Thank you for listening again. I'm Kevin Hall. Thank you for letting us help Lexington be well. We'll talk to you very soon.